coming up.
For honor and glory, let the battles begin.
Hear ye, hear ye. Find out what it takes to be a jousting knight of yore. Then come back to the present day where a different sort of chariot awaits. Pedal boat with us, learn how to perform CPR, and listen to the experts.
All this and more is today on SoFlo Health. Spring has almost sprung. Not quite, but we're certainly getting there. It is definitely warmer, and it's time to get outside and enjoy our parks. Well, it's pretty much always time to do that. Hello and welcome to SoFlo Health. I'm Hunter Frankie, and today I am at TY Park to show you some of the things that you can do to get moving or to cool off while you're here at the park. So let's go meet Isabella, talk about the water park, and then I want to get on one of those. As promised, this is Isabella. Isabella, thanks for spending some time with us today.
Of course, it's great to see you today.
Well, thank you for having us. Where are we?
So we are currently at Castaway Island at TY Park.
And what is Castaway Island?
Castaway Island is a water park we have at TY Park.
Okay, great. Yeah, so as you can see, there's nothing going on right this moment, but it will be up and running soon. And how long does it run through?
So it's open seasonally up to October.
Okay, great. So you've got plenty of time to come and enjoy. And what else is there to do here at TY Park?
So we also have paddle boats at TY Park, along with camping grounds, shelters to rent, tennis courts, and basketball courts.
Sounds like there's a lot to do.
Of course.
What if I want to just go for a nice walk?
Now we do have a 2-mile track that you can walk around TY Park. In addition to that, we do have a club that people love to join, and you can go ahead and get prizes for that.
And is there any cost?
No, none at all.
No, you just head on over and join that club, and you can take a walk whenever you want.
Yep.
And Isabella, who's welcome here?
So everyone's welcome here at all ages. It's great for family birthday parties and just events in general.
And what about if I have like a child, like a kid, 1-year-old, 2-year-old?
Everyone's welcome.
Everyone's
all
welcome?
ages.
Perfect. If people want to learn more about Broward Parks or what they can do here or check on what's available at what time seasonally, how can they?
So you guys can go ahead and head down to broward.org/parks and you can get all the information there.
Perfect. Now, I'm kind of in the mood to pedal around on the boat. Think I can do that here today?
Oh yeah, let's go.
All right, let's do it. Now this is what I'm talking about. What do I need?
So this is all you need.
This is all I need?
Go ahead and buckle up and you'll be on your way.
Great. Well, thank you so much.
Of course, enjoy.
I will. All right, I'm gonna get buckled up here, situated in one of these boats, and then I'll see you after you watch this. Today I'm joined by Denise of Baptist Health, and she's an instructor for the American Heart Association, which is important because today we're going to talk about your heart health and CPR. Denise, thank you so much for spending some time with us today.
Thank you. Thanks for having us.
Let's start off with, why is it important to know CPR?
Each year, 436,000 more people die from a cardiac arrest. 350,000 of those will die outside in the community, not in a hospital.
Wow.
So that's 3 out of 4 people will be probably in a home. So by just simply learning hands-only CPR, you could save someone's life.
If there's an emergency and you think somebody in your house is having cardiac arrest, what should you do?
The one thing that we teach is to call 911 and call them fast. So if you have a cell phone, you could pull it out, call 911, leave it on speaker, have someone else call. And then if they're unresponsive, not breathing, no movement, then we would encourage that hands-only CPR. And that allows the blood to circulate through the body and then allow for a better outcome when advanced care does arrive.
Right. And I noticed that the first thing you said was call 911. Why is it important to reiterate that?
Well, I can't emphasize that enough because so often people will say, oh, you're not feeling well, or ooh, this, and they drag them in the car to the hospital. And you can't do that. You can't drive and do CPR, and you certainly can't drive, do CPR, and provide a shock to the patient.
Right.
So many people will die in the car en route to a hospital.
Right. So we don't want to have that happen, of course.
No.
So your best case scenario is to take the guidance you can get over the phone, wait for medical professionals to
And
arrive.
hopefully they'll arrive within a few minutes.
Yes.
So every minute the patient goes without advanced care, their chances of survival will go down. So we want to encourage that hands only as quick as possible, getting that blood flowing.
Now, if somebody would like to, or need not like to, but if they need to perform CPR, what should they do?
So the American Heart totally encourages everyone to look around and make sure that the scene is safe before they advance. But then we would want to find out if the person's awake or sleeping under a palm tree in South Florida. So we'd come up and call their name or just, hey, are you okay? Check for responsiveness. If this individual isn't responsive, no signs of life, no eyes movement, no hand, no anything, then I would certainly be calling, hey, you in the red dress, will you go call 911 for me? If I don't have a phone, get help on the way, and then you just start your compressions, pushing hard and fast.
Is there anything else somebody needs to know? How long do they do this?
You're going to do it as long as you can push hard and fast. Hopefully, as other people learn CPR in the community, somebody could relieve you, and take turns back and forth.
Well, Denise, thank you so much. We're not done here just yet. Keep watching SoFlo Health, because later on, we're going to put me to the test to see if I can do this properly and talk to you about some resources available to you in the community.
SoFlo Health contributor Aniva Zaman heads to the Florida Renaissance Festival to find out how the Knights prepare for jousting when SoFlo Health returns.
Focusing on you. Innovations in modern medicine. From your team of experts at UHealth, the University of Miami Health System.
UHealth's premier division of cardiology is soaring into the future of cardiac care under the leadership of Dr. Yanis Hatzizitzis, UHealth's new chief of cardiovascular medicine.
I feel excited for being part of this amazing family of physicians and staff and fellows.
This world-renowned interventional and imaging cardiologist plans to bring innovative therapies through digital medicine and the new Computational Cardiovascular Simulation Center.
That center, in a nutshell, has the mission to transform cardiovascular interventions worldwide through personalized computational approaches, which at the end of the day help us provide more precise, more accurate diagnosis.
UHealth's commitment to world-class cardiac care is being realized with new digital technology, using AI, simulations, and virtual reality for better personalized patient care.
We do have already preliminary results showing that using simulations we can guide procedures in stents, also in surgery.
The goal is to focus on precision medicine as well as preventative cardiac care.
A division that will be a hub of the latest technologies and a hub of innovation and excellence.
Welcome back to SoFlo Health. I'm Hunter Frankie, and I'm still at TY Park, and I'm ready to pedal boat now. I've got my vest on, I'm in the boat, and that's really all you need. There's nothing left to do but to push off and to pedal. All right. Well, here we are, pedal boating. I just gotta say, if you're looking for something to do, just for fun, to get some movement, this is actually a bit of a workout, especially if you're just pedaling on your own. If you have a friend, it actually may go a little bit faster if they're pulling their weight. Either way, it's a way to break things up, have some fun, and just get out in one of our beautiful Broward parks and get some movement. So keep watching SoFlo Health, and I'll keep pedaling around. Come on, hurry up.
The streets are teeming with knights in shining armor, royalty, and delicious food, and that can mean only one thing: the Florida Renaissance Festival.
While there may be a lot to do here, I'm here to meet a few knights and learn some trick of their trades. Hi, I'm Aniva Zaman for SoFlo Health, and I am here at the Florida Renaissance Festival with our knights in shining armor. So guys, it looks like a lot of work gets put into being a knight. Tell us a little bit about the process.
It's a lot of cardio. You got to get used to being in the sun.
And we're in Florida, so...
Yep, the weather's definitely a factor. A lot of upper body, swords and shields get heavy after a while. All that comes from your forearm. And of course, these guys really do most of the hard work.
I see that, definitely.
They do a lot of the running.
Horseback riding itself is the primary part of us doing the jousting.
Horseback riding is a lot of core, it's a lot of balance, and a surprising amount of rhythm. Kind of have to be in tune with their rhythm to keep things smooth.
And what do you guys do to keep up with the training?
We ride usually 2-3 times a week. We have to stay in shape. These guys have to stay in shape. Right. We usually do conditioning throughout the week. Since
we're in a historical setting, would you say knights back in the days would go through the same training as you guys are doing now, or would it be different?
I'd say it'd be worse. Back in the Renaissance medieval age, for a person of the status of knighthood to own a horse horse was a huge privilege. One of the most main modes of transportation. Knights were expert riders. Nowadays we have modern saddles and modern tack, kind of give you a little bit of an advantage. When you're wearing an extra 80 to 100 pounds of armor, because especially in the Renaissance period, you're looking at knights in full plate, it makes you very top heavy. Both of us have ridden in large amounts of armor, and it is a huge difference. We have archaeological evidence to support people and horses were all smaller because nutrition was a big issue back then. Most of your daily exercise comes from taking care of your horse. So it's a lot of just passive exercise.
So tell us a little bit about the sword training that you guys have to do. What do you guys do to prepare for that?
I think in both our cases, a lot of it was growing up playing with sticks in the woods. Just got used to carrying them, and it evolved into this.
We do follow a method of stage combat, have our own unique blend. Both of us are big history nerds and are really into historical martial art. So we like to throw in as much realism as we can with our sword fights.
So you guys would say that would be the difference between theatrical jousting versus competitive jousting, right?
Absolutely, yeah. Competitive jousting is usually full armor, full body targets. Theatrical jousting is just as real as competitive jousting. We are hitting each other, cannot change the laws of physics. Our horses are still moving fast, we're holding solid objects, and we're hitting a solid object. The biggest difference is that our target is very specific, it's our shield. Our intention is to do a show that is entertaining, also impressive and professional.
So aside from jousting, what else is there to do here?
Well, there's lots of things here to do. We have themed weekends.
Various musical acts.
Of other musical acts and different comedy acts. As soon as you walk through the gate, it's like stepping back in time between the food that you eat, the entertainment that you see, the people that you interact with on the streets. It's truly like stepping through a time machine.
And even us, we transform into characters out on this field.
Absolutely.
Do you guys have character names?
We do. I am Lord Urson, the Bear of the Balkans.
And I'm Sir Keegan O'Connor, the Go Away Kid.
I guess I need a new name too then. I'm gonna go try out the costume and see how you guys fit into this heavy duty outfits. See if I can keep up with you guys.
Yeah, absolutely.
So I did exactly that and had the privilege to be the queen and see the knights in action.
For honor and glory, let the battles begin.
I'm joined once again by Mitch of Panther in San Pedro to talk about some law when it comes to your health, because that's one thing that maybe you don't consider right away. One question I have for you, Mitch, is how do I know that I've just had a bad result, I don't like how I was treated necessarily at the medical care provider, or there was actual malpractice? What's the difference?
So there's a big difference. First of all, let's define medical malpractice.
Right.
Medical malpractice is when the doctor, healthcare facility, healthcare providers, nursing staff, anybody medical related, providing medical care and treatment to you, does something wrong. And that there are damages that flow from that. The damages need to be quite serious because the pursuit of a medical malpractice case is expensive, time consuming, and you need a skilled, qualified attorney that can represent you in that kind of case.
Right. So the staff was kind of ornery and I didn't like my experience. That's not malpractice.
We get those calls every day. The doctor wasn't nice. The nurse didn't give me my food. My food when it came was disgusting.
Right.
That's bad treatment. That's not medical malpractice.
Yeah, that's unfortunate, but that's not malpractice.
And the advice I give to people, complain. Talk to administration, talk to risk management, talk to people so it doesn't happen to somebody else. But the lawyer's not going to do anything for you because there's no case there.
Right. Now, what would an example be of malpractice then?
So malpractice is when you go to the hospital and you're supposed to operate on your left leg and they operate on your right leg. But even then, what are the damages?
Right.
Things have changed so that now they'll put a big X on the leg that they should operate on or shouldn't operate on. That's medical malpractice. Medical malpractice is when they give you the wrong medication and you have serious results. You're allergic to penicillin. It's in your chart, you're allergic to penicillin. They give you penicillin, you have shock, you have treatment, you get really sick as a result of it. That's medical malpractice.
Now, somebody's watching right now and they think, you know what, that leg situation happened to me, but that was so many years ago. What's the window of time somebody has to go after something like this?
So that's called the statute of limitations or a time limitation. In all cases, whether it's an auto accident or medical malpractice, there are certain time limitations within which to pursue a case.
Right.
In medical malpractice, it's a shortened time limitations, generally 2 years from the date you knew or should have known of there being malpractice. So what we tell people is go get treatment, get it taken care of, go to a lawyer immediately. If you wait more than 2 years, there are certain exceptions within the law, but generally speaking, 2 years is your time window.
Hopefully this is something you never have to deal with, but if you do, you should certainly seek legal counsel. And if people would like to learn more about this subject, how can they?
Well, again, on our website, pantherlaw.com, we have frequently asked questions, but more importantly, feel free to give us a call anytime.
Excellent. Well, Mitch, thank you so much for sharing.
Thank you.
Appreciate it. The annual Spring Fling is back in the city of Margate. Open now and runs daily through Sunday, April 2nd. The Spring Break Family event features rides from around the world, plus plenty of rides for kids and families like Ferris wheels, carousels, bumper cars, and more. And don't forget the food, international fair food from around the world, and delicious dishes from many of your South Florida favorites. You can find tickets on Facebook and Eventbrite. Don't miss this family spring break spring fling going on now through Sunday, April 2nd in the city of Margate. Pedal boating, medical advice from the experts, and more CPR training are after the break on SoFlo Health.
Welcome back to SoFlo Health. I'm Hunter Frankie, enjoying a nice pedal boating session out at TY Park. If you've never been on one of these and you're wondering if it's difficult or what you need to know, the answer is no, it's not very difficult, other than it is difficult to pedal all by yourself. And if you have a friend, it's easier. And here's how it works. If you pedal forward, you go forward. If you pedal backwards, you go backwards. You want to turn? You got a little steering wheel right here in the middle. Left takes you left, right takes you right. It's not the opposite. It's quite simple, and it's quite fun. So I'll keep pedaling. You watch this. I'm Hunter Frankie, and if you missed this earlier, I'm with Denise of Baptist Health and the American Heart Association, and we were going over CPR and why it's important to know. So one quick recap. Denise, why should people learn CPR, and what are the quick steps they need to follow?
Well, people should learn CPR because you can save lives. That's the bottom line. The steps to follow are very simple. It's 2 steps. Call for help when you need help, when someone is unresponsive or not responding to you, and put your hands on the chest and start CPR.
Well, now let's see if I was paying attention.
Let's do that.
Now I've got a little bit of a footstool here for
there
us,
to help you out.
just to be extra in the proper position.
Okay.
So I call 911. I check the person. I say, hey, Bob, whatever your name is, are you okay? Are you responsive?
Yeah.
They're not responding. So now I begin CPR, and I should do this?
I would encourage you to make sure the scene is safe before you jump into action, just in case there's something that would danger you. So go ahead and put the heel of your hand on the lower half of the sternum, and we say the heel, not the fingers, so that you're pushing with that.
So to be clear for people that can't see my hand, right here.
Yeah. And the middle finger kind of falls over the nipple line or the imaginary nipple line, whatever it might be, whether it's a woman, a man, either one. And just push deep and hard and fast, we say, to the beat of the Bee Gees, 100 to 120, you know, staying alive, staying alive. There you go.
Perfect.
And you're going to do that. Hopefully someone else has called 911 for you when you ask for help, and they will help coach you through as well.
That's wonderful.
Someone arrives to help you.
Yes, and earlier we were talking about the importance of calling 911 because although you might think you're helping by wanting to take somebody to the hospital, if something happens while you're in the car, it gets a lot worse and a lot harder for you to handle.
Yeah, usually someone that's has a cardiac arrest ends up in that lethal rhythm within 4 hours of experiencing the onset of that chest pain.
And it's always difficult when you have the situation arise, but if you're prepared ahead of time, it's a lot easier.
Yeah.
And speaking of that, we've got some tools behind us helping the community stay prepared.
Right. The American Heart has a package for the schools to learn. We can take it and phys ed teachers, anyone within the school, and then you can also purchase it. So we have an infant for moms, new moms that might want to learn CPR, as well as adult mannequin that they can practice. American Heart's really encouraging that at least one person in every household knows CPR. Of course, our goal would be that everyone learns it. And you did a good job. I would pass you today, Hunter. You succeeded.
Well, thank you so much. I'm glad because it's important to me. You know, I've had somebody in my family have a heart attack. I know many people that have had somebody that they know or in their family that have experienced cardiac arrest. And it's important to be able to do that, to know this in case if you're in a position to be able to help, that you can and will.
Definitely.
If people would like to learn more about CPR or how they can get involved, how can they?
Well, the American Heart has a website. You can go to heart.org, multiple resources.
Well, Denise, thank you so much for your time. Thank you to the American Heart Association, of course, and thank you to Baptist Health. This is important stuff, and we're happy to bring it to you today. Thanks to Denise. Thanks a lot.
Thank you.
It's actually pretty peaceful out here in the middle of the lake at TY Park. And pedal boating is a lot of fun, something to do that's different, get you moving, and enjoy one of your beautiful Broward parks. Now, they're not the only park that provides something like this. In fact, a lot of the parks have plenty of amenities, and you can check those out on broward.org/parks, like we were told earlier. And as much fun as this has been, as many calories as I've burned, I'm ready to head back. So I'll see you by the docks. You watch this.
We're back at MyCare Medical. I'm here with Dr. Kapoor. Dr. Kapoor, I heard a phrase, healthy living or living healthy.
Healthy living is learning to live healthy. Either you're reading an article, you're talking to your physician, or you're watching a show, or you're reading a good book about it. And living healthy is the steps you will take to make yourself healthy. Putting those plans into action. Eating healthy, doing your exercise, not smoking, controlling your chronic conditions, and having a very good family or a social circle, and a few other things like sleeping well. People, I think, underestimate how important it is to get a good night's sleep, and a few other things which you will learn as you go down and learn about what is living healthy means to you.
Is this something that you educate your patients on here at MyCare Medical?
Every day and all the time, and it never stops.
It's also very important to be 100% honest with your physician. Why is that?
What you tell your physician is going to determine the accuracy of diagnosis or arriving at the diagnosis at the earliest, and also having a plan of care in place.
What's the best way for a patient to prepare to visit the doctor?
One, arrive a little bit early. Write down your questions. What is the purpose of this visit? It's very important that you should accomplish 100% satisfaction, most likely before you leave.
Dr. Kapoor, thank you very much.
Oh, thank you for having me here. I really appreciate it. Thank you.